Hello, welcome back to my channel. My name is Dorcas. If this is your first time seeing my face, I'm happy to have you here. If you're a returning subscriber, thank you for always stopping by. Today we are going to be discussing a crucial topic that would help you in your cancer treatment journey. Questions to ask when you are just diagnosed of cancer. Previous research has shown that patients who are actively involved in their treatment journey yields better outcome compared to those who take the passive route. Hence today we are discussing some of the major questions you might need to ask your doctor after being diagnosed of cancer. And these are all reasonable questions that you probably would not think about in the spot of the moment. But before then, you need to determine the amount of information you can take. For some people, they can take a lot of information in and be fine. But for other people, their treatment case is different. They might feel overwhelmed when there's a lot of information going on. So what you want to ask yourself is, how much information can I actually take at this moment, at this point in time? Because you don't want to overload yourself with a lot of things and you completely forget about your happiness. So before going into the questions you might want to ask, kindly note that this video is for educational and informational purpose alone. This should not replace what a medical personnel will tell you or what your doctor says. Now let's talk about the top questions to ask your doctor at your first visit to the clinic as a cancer patient. So the first category of question you want to ask falls under understanding the kind of diagnosis you have. So for example, you're asking what kind of cancer do you have? You're asking what stage is the cancer at the moment. You should also ask if there are specific characteristics of the cancer type that affect the kind of treatment available and prognosis. The second category of question falls under the treatment plan. For example, there are different kinds of treatment options available for cancer patients. There's radiotherapy, immunotherapy, chemotherapy, targeted therapy, and a lot more. But in some cases, you might need to combine 2 or more different kind of treatment together. So you need to have like an accurate understanding of what treatment option your doctor would suggest you have. So in asking that, you want to ask what are the treatment options available. You want to ask for the goal of each treatment options. Are they to cure cancer? Are they to relieve the pain? Is the treatment to improve the quality of life? Or is the treatment intended to control the growth of the cancer cells? Knowing that will help you make informed decision to actually select the kind of treatment you might want to go for. The third kind of questions you might want to ask falls under clinical trials. You might want to ask your doctor if there is any clinical trial ongoing or anyone that might be available for you to join at the stage of cancer that you are in right now. Basically, in clinical trial, you'll be part of the subjects being used to try out new medications that would be used for the treatment of cancer. And this is not to use you as a scapegoat, because the goal of clinical trial is always safety first. So be rest assured that for any trial you might be participating in, your safety is the most important to all. And deciding to be a part of that would require that you actually ask the right questions. You want to ask for the goal of the trial. You want to ask for the type of the trial. You want to ask any question that might come to your mind and be 100% certain that you understand what is going on, and also ask for the benefits and risk of the trial, because as much as the trial is to aim for better treatment of cancer, there might be some risk of doing that, and to make an informed decision you need to accurately understand all of those. So you would ask your doctor if you want to be part of a trial. And being part of a clinical trial is basically making the world a better place than you made it, because if you as a subject is used to try out a new medication, you are paving way, making life easier and bearable for many cancer patients that would come after you. After or before selecting your treatment plan, you might want to ask for the side effects. What should be the expectation of going with each treatment options? Are there side effects to it? Are those side effects something that are bearable? Are those side effects something that can be managed over time? So those are questions to ask. You also want to ask, how the treatment would affect your daily life. Like, is there going to be like a change in the way I live my life on a daily basis? If you're used to working out every day and evening, do I need to reduce it? Do I need to keep going at that pace, or do I need to completely stop? Or if you never used to work out, you might want to ask, oh, do I need to start a fitness routine? How is this treatment plan going to affect my day-to-day activity? Is there going to be a change in the kind of nutrition I take? So those are questions to ask your doctor on your visit. Another thing you want to ask your doctor is the financial budget. As much as your doctor probably won't have like a exact amount of figure to call for you that, oh, you're gonna need this amount of money, that you could ask for like a potential range. That way you're able to plan ahead and make the best decision in selecting your treatment option. One other critical question to ask is asking if there are people to talk to. Is there like a supportive group so as to introduce you to one? Is there like a online community so that you can be part of one and share information as you go through your treatment journey? And of course, lastly, ensure that you get the contact of your doctor. I mean, this might sound like, why don't I have the contact? Well, always remember to have a contact of someone you can reach out to just in case of any emergency, or just in case you have a quick question to ask for, oh, who can I reach out to? What if your doctor is not available at that moment? Is there anyone else to reach out to? Just to have contact with your medical team. And if you have any other question apart from those that I've listed, feel free to ask your doctor. Remember that your doctor are always there to answer your question and guide you, help you through your healing process until you are fully healed. Thank you for sticking to the end of the video. If you have any other question that you might want to suggest that they ask on their first visit to see a doctor, ensure you put it in comment section. You will have to like, comment and share if you find this video helpful. And until next week, ensure you stay healthy.